This is a presentation about improving interprofessional learning in adolescent health with a focus on diabetes. My name's Stephanie Lamb, I'm a GP in South London and have a special interest in adolescent health.
My name's Alex Silverstein and I have type 1 diabetes and was the inaugural president of the IDF's Young Leaders in Diabetes programme.
What we're trying to do with this slide set is create a training package to improve young people's health, but with a specific focus on better management of diabetes. So, self-care in adolescence. What we do know is that health self-care learnt during adolescence is fundamental to the healthcare behaviour that young person will maintain as an adult. This is incredibly important for young people with diabetes, as it can make a huge difference in terms of outcomes. What we do know is that in young people with diabetes, there is a high risk of poor adherence to medication regimes and attending both primary care and secondary care reviews, which can result in significant increase in the risk of complications for them. As health professionals, we need to be aware of and understanding of the particular difficulties for a young person with diabetes. This is really well illustrated by this clip about how this can impact on a young person with type 1 diabetes. So, to reiterate, what we need to be aware of, they are frequent non-attenders at outpatient appointments, and this will result in poor outcomes and long-term morbidity. At the same time as having diabetes, they have the same issues that go on with all young people as they go through adolescence, and we need to be aware that there is particularly an increase in the risk of mental health issues when associated with a long-term condition such as diabetes. So in terms of making the most of the adolescent consultation, there are 4 things I find helpful to bear in mind. The first thing is about adolescent brain development. What this means is as young people go through adolescence, their decision-making processes change, and they change from thinking in a very concrete way to thinking in a much more abstract way. They have different influences, in particular peers and the immediate context of their lives has much greater importance than it does for adults. And it is important to bear in mind that most adolescents are not capable of rational adult behaviour. Language development is also very important, and adolescents have just over half the amount of words in their vocabulary than a mature adult. This will impact greatly on how they can articulate, particularly around thoughts and feelings. Bearing this in mind, it can be very helpful in the consultation to ask them closed questions, and this will often get a better response. Confidentiality is still a major concern, and it's very important to be explicit about this during the consultation, including telling them what you mean by terms of harm and in what context you would break confidentiality. Always remembering to tell them that if you were going to break confidentiality, you would always let them know. Finally, the environment. The setting for the consultation is very important. It is particularly important to negotiate time alone with the young person. This can often be quite intimidating for the practitioner, but in order to normalise this, it is useful to tell parents and the young person that this is a routine that you have for any young person above, say, the age of 13 or 14. In the time alone with the young person, it's important to again be explicit about confidentiality and give them the opportunity to tell you really about how they're feeling. In this way, you can develop a trusting relationship with them and they will feel that they have been heard.
So now I'm going to talk a little bit about what do I need as a person with diabetes. And I put it down to 4 E's, the first of which is equipment. So I need obviously my insulin, test strips, a healthcare professional team, and an understanding of my medical data. I have an app on my phone where I can look at my medical records and can also order repeat prescriptions, which makes it a lot more convenient for me. The next E is education, and it's probably one of the most important ones to me. And I was 18 months old when I was diagnosed with type 1 diabetes, but it wasn't until I was 18 that I actually received education about how to self-manage my care. And in 5 days I learned more than I had done in 16 years. So for me it's really important that you learn education as soon as possible. And I get my ongoing education from things like Facebook and Twitter and many online resources, as well as speaking to my clinicians once every 6 months when I see them in clinic. The third E, and this is a really important one, is empathy. Because until you accept your diabetes, it can be really difficult for young people to manage it and understand it properly. And it really does take acceptance from your whole family, because managing diabetes is a partnership between your healthcare team, your friends, your family, your school or place of work. And if they don't accept it and understand what you need from them, it can be really difficult for young people. But equally as important, healthcare professionals and your friends and family need to know what you need from them. So it works both ways, and that's where the empathy factor comes in. The final one is engagement, and it's active engagement. I say active because it's about a lot more than just turning up to your appointments once every 6 months for a blood test. You should be kind of using the education you've been taught for experiential learning, actually trying out through diabetes camps or meeting people, or just trialing in your everyday life ways to manage your diabetes, whether that's by going traveling or by doing exercise. It's about those things that you need every day. And overall, this 4 E's helps to build confidence in managing your diabetes, and it's really important that you realize that this is just as much your responsibility and the responsibility of everyone involved in your partnership of care than it is your healthcare professionals. And so, obviously it's your responsibility to get your repeat prescriptions, pick them up from the pharmacies, and go to your appointments. But it does take a partnership to look after you. So the take-home tips from me are that young people need equipment, education, empathy, and engagement to help them manage their diabetes. And you can help make the most out of my consultations and my life by following the messages that Steph put forward, and also by realizing that referring me to educational courses and ways of looking after myself better can really help me to achieve the things I want in life. If you would like some further resources, then you can get all the information about that education course that I did called Daphne from their website below, as well as visiting the website for young adults from Diabetes UK called Type 1 Uncut, and finally at the bottom, Input, which is a charity that helps get access to insulin pumps and technology. They have a full list of kind of online resources that you will be able to provide to your patients. You'll be able to find all the resources here and more if you just click on the description of this YouTube video below. Thank you very much for watching this presentation, and if you would have any further questions, then feel free to email us on the email addresses there.